The views, opinions, and presentations of the guest are not intended to establish a standard of care to be followed by the audience. Always seek the advice of your physician or other qualified healthcare provider with any questions or concerns you may have regarding your health. Furthermore, the assumptions, views, opinions, and insinuations made by the host and guest do not reflect those of the show and the management.
Hello, everyone, and hello, Facebook viewers, and welcome to another episode of Health Talk, a day forum by Zach and Zidus. And today, we will learn how to cope with uncertainty, focusing on our future self. Now, does this sound interesting to you? Our guest speaker will bring to the table the concepts of liminal space and Bentoism. Now, if you haven't heard about this, just stay tuned because in the next 3 minutes, we will be enlightened by this concept and how we can apply to our future self. But first, let's get to know our speaker. Dr. Antonio Sison is the only board-certified psychiatrist and board-certified dermatologist in the Philippines. And the reason for this dual residency is his interest in pursuing the field of psychodermatology. And further, he is also a certified eye movement desensitization reprocessing therapist, or EMDR, which he had used successfully on cases of post-traumatic stress disorder, or PTSD. Now, currently, he is associate professor at the Department of Psychiatry at the University of the Philippines, Philippine General Hospital, or UPPGH. He is also a board member of the Philippine Psychiatric Association, or PPA, serving as auditor, and a consultant at the Skin and Cancer Foundation Incorporated. So, ladies and gentlemen, it is my honor to have with us today Dr. Antonio Sison.
Okay. Can you hear me? Um, okay. Okay. So good afternoon, Facebook people. Thank you very much for showing interest in attending this talk. I'll be talking about coping with uncertainty, which I think is something we all collectively share. However, my slant to this talk will be focused on self-reflection on the future me. Next slide. I have no conflict of interest. Next. Okay, so it's really essentially a very short lecture. I'll be talking about COVID-19 pandemic as a global disruption and the concept of liminal space as well as the concept of Bentoism. Next slide. So in everything, it always starts with a concept, with a question. So what exactly is this question? Next. Who was me before the COVID-19 pandemic? Can we have the next slide, please? I think, do you still remember who you were prior to the lockdown, prior to the coronavirus pandemic? Well, I suspect just like everything else, we had career goals professionally. As a psychiatrist, I actually plan my trips and my career 2 years in advance. Moreover, I also plan any family trips as well way in advance. And I always try to have a work-life balance. And admittedly, my time schedule was rather hectic, trying to cram in both the professional and personal duties that I'd like to accomplish. Next. So how did the COVID-19 pandemic change me? Perhaps to understand this, let us first understand the global impact of this pandemic. Next. Next slide, please. You do understand that we are all experiencing history as in unfolding. This is the first time in human history that we actually, as a whole, are experiencing this pandemic. and also as as the whole world is experiencing lockdown. And this definitely will impact on global health, public health, and how that impact on the individual health of the individuals in different countries depending on the status of their healthcare system. Moreover, especially because of the lockdown, it does impact on global financial health as well. That includes closure of business establishment, retrenchment because of redundancy, and definitely we are going to expect economic recession. So certainly all of this have a lot of impact both in health and in financial health as well. Next slide. So how did the COVID pandemic change me in terms of how it impacted on me on a personal level? Next. Certainly, we all know that all our plans, be it international trips, be it lectures, be it CME, be it conventions, were all canceled. The Philippine Psychiatric Association had canceled its mid-year convention, as well as in other medical societies as well, precisely because of the fear of getting infected with COVID-19 virus. Moreover, even our family goals have been compromised. And when we talk about work-life balance, we had to recalibrate what work-life balance is during lockdown. Essentially, when they say you work at home, it's rather difficult because the sense of boundaries is not there. In one way, it's convenient because when I do telemedicine, I don't have to travel anymore. But that's a convenient part of it. But in another way, somehow you still have to strike a balance between work and life balance. Moreover, initially in the first couple of days of lockdown, I had problems trying to fix my time schedule because I was at a loss of what to do with my time. Certainly things are much better for me now. Next slide. Certainly, I think if there's any common theme with this disruption, it threatened my sense of safety. Admittedly, since the lockdown, I have not left my home. Moreover, aside from my threatened sense of safety, the reality is I cannot predict anything, for the next perhaps beyond 2 weeks. The lockdowns may change during that time period, but early on, it was really very unpredictable. And this challenge continually to challenge us the way we cope in terms of the new sense of time and new sense of order. Next. So even as we are experiencing all of this disruption, we are continuing to balance health concerns with financial concerns. Should I go out, in order to earn money, or should I stay home, but perhaps not earn money? Moreover, this disruption offers an opportunity for us to reassess personal relationships, as well as reassess the values that we hold dear. Next. So with this disruption, it is an opportunity to self-reflect not only on me, but also on the future me. Next. So the question now is, next, who is the future me? Next. How would me understand the future me? And one way of understanding this is the concept of liminal space. Next slide, please. Okay, liminal space comes from the word liminal, which is actually derived from the Latin word limen, meaning threshold or any point or place of entering or beginning. Liminal space is the time between what was and the next. It is a place of transition, a season of waiting and not knowing. What an appropriate description of what we're experiencing right now. Next slide, please. Moreover, liminal space is where all transformation takes place if we learn to wait and let it form us. It also challenges us to be present with the uncertainty we're facing. Another way of interpreting liminal space is that this is certainly a time period of uncertainty, that we may have upheavals, we may have vicissitudes of good things and bad things, but still the element of unpredictability. Now, one view of dealing with liminal space is actually maintaining equanimity, being serene and being calm in spite of the uncertainty that we are facing. And once we're able to maintain this serenity, this equanimity, this is actually the time period wherein some people would say that we have the most spiritual growth, because we are able to deal with uncertainty, and that challenges us to be very present and to also accept to whatever things are unfolding before us. Next slide, please. So this is a diagram of what liminal space is. You had our life before the pandemic, and we're still unclear what this new normal would be or how that would look like. We are all anticipating and hoping for a vaccine, but it's still not yet there. It's still uncertain. So that new normal is still undefined for now, but we are coping each day as it comes. Next slide. So when you imagine yourself now in this liminal space, in all of its uncertainty, you would now calibrate your expectations as far as your professional goal. You will also calibrate in terms of your personal goals as well, and how you would balance now the work-life balance in this period of uncertainty, and also try to develop a time schedule that works best for you. Next slide. And liminal space, I think the gift that we can glean from all of this uncertainty, because it provides us an opportunity for change. Moreover, it also would allow us cognitive interpretation for this. You can say that the pandemic was a disruption, but if you're going to reframe that, you can also reframe that the pandemic was a pause instead of it being a disruption. A pause that would allow us to self-reflect on who we are and where we were going before, and should we revisit that and perhaps change on where we're going next, precisely because of this opportunity to change. Next slide. So you understand that liminal space provides us a philosophical construct of understanding the future me in the new normal. Okay, so you get the philosophical construct, but what technique can we use to understand the future me? Next slide. How would me understand the process of becoming the future me? And this is where the paradigm of Bentoism would come in. Next slide, please. So you're going to ask, you probably have never heard of Bentoism. And to be perfectly honest, I only perhaps heard about it in the last 2 weeks when I was watching a podcast. And it really struck me as very interesting, especially since it was developed by Yancey Strickler. Next slide. So you're going to ask, who exactly is Yancey Strickler? Well, he's an American author, entrepreneur, and former music critic. And moreover, he co-founded Kickstarter, the funding platform for creative projects. Next. He is also the author of This Could Be Our Future, a Penguin Random House book about building a society that looks beyond profit as its core organizing principle. And he was the one when he had written this book, conceptualized Bentoism as this new paradigm. Next slide. So, where can you learn about Bentoism? Well, in their webpage, and which I'll be showing you next. This is where I was able to learn, aside from the podcast, I was able to look into the webpage and really understand or get a glimpse of understanding this concept of Bentoism. Next slide. So in order to understand, let's first start with the bento box, as you can see here. It's certainly a Japanese word. And of course, this looks more modern now than Japanese. But this is what you would also consider a bento box. Next slide. Now, the word bento derives from a Japanese word meaning convenience. It actually honors the Japanese eating philosophy of Harahachi-bu, which says the goal of a meal is to be 80% full. Certainly, that is not the goal when Filipinos eat. As you know, when you come here to Manila, we are buffet paradise. They certainly want to go out the restaurant 100% full. But anyway, this is still nonetheless a very important concept to reflect, since after all, in liminal space, we have to reassess. Perhaps eating a meal 80% full is maybe worth trying to see how it would feel versus finishing a meal 100% full. Next slide. So Bentoism is really a guide to self-coherence. It actually helps individuals and organizations create self-coherence, meaning your goals and the process of achieving their goals are coherent. And it is guided not just by profit, but also by your values. And it is also a guide for our true self-interest. Next slide. So how do we start? This is a graph which we all understand very well. In the x-axis is time, and in the y-axis is self-interest. Now, if you're a businessman or if you're a professional, what you would like is to see your profit shoot upwards as the time you start your business, because that would mean there is your self-interest is increasing in value. We all get this, right? And this is something which perhaps capitalism and commercialism really would simply focus on. The bottom line is, I want to have good profits and I want this to continue going up indefinitely. Next slide. However, this graph, the graph that I presented earlier is actually part of a bigger picture. And why so? Because if we extend the y-axis of self-interest and extend the x-axis of time, this is how the graph would look. Next slide. If we extend the concept of time, we see now that we have now me, which would then project to become the future me, because this is the time axis. More so, in the self-interest axis, you see me, but as you extend it also to the people that you love. You extend it to your family. You extend it to your community, and you can even proceed to extend it, to the country and maybe to the world. So you see now, from that initial graph, we actually are just seeing one part of this bigger picture that includes me to us, that includes now me to the future me. Next slide. So you're wondering, okay, but where does the bento box come into the picture? Next. And this is where it comes into the picture. In the bento box I shown earlier, it had 4 compartments. So in this graph, this will be like a bento box that divides the graph into 4 parts. So what does this mean? Next slide. Next slide. Yes. So here you see the 4 compartments. You have the now me, which will ask the question, what do I want? What do I need? You will then go to the next compartment, the future me. What does the future me want and need? And then we go up, the now us. What do we want or need? And the future us. What does the future us want or need? Next slide. Now, in clarifying, you could actually use this bento box as a way of clarifying an issue. For example, in case you're a smoker, one question you could ask is that, should I stop smoking? And next slide. And here you see how that discussion would entail not just you deciding, but you to consider other factors as well. If I'm a smoker, certainly I'm going to say, no, I don't want to stop smoking. But then again, if I project to the future me, I probably should stop smoking because, my health will be compromised if I don't. So certainly my future me would say yes. Now, with the people that I love who I'm close to, they probably will be subjected to secondhand smoke, which, as you know, could actually be more risk, increased health risk for them than the actual smoker. So certainly they wouldn't want that. And they would also advise, yes, please stop smoking. And moreover, in the future us, because they want me to be part of the future us as a healthy person, they also would like me to stop smoking. But here you see now, you go through the process of discussing the problem in these 4 different compartments. Next slide. So this is a technique that you can use individually. Families can also use this as a format for discussion. Even corporations, wherein you factor not just your profits, but also your values. Next slide. What is interesting is as I was pondering on the bento box, I actually think it can also be used in psychotherapy, wherein I could clarify the goals of the patient and not just to focus on the now me, but really ask the patient, what kind of dreams, what kind of future do you want? So I could help you, bring you there. Moreover, it also reminds me to have the patient's family involved in this process and for them also to participate on how they feel now and what their thoughts are now, including what their future plans would be. So in doing this, you see that although it is primarily a way in which you go to decision making, I actually believe this also has applications in psychotherapy, and I really would be interested to actually try it out. And if you say, is it only applicable to psychotherapy? I believe even in dermatology as well, more so for patients who come in for cosmetic procedures. Certainly, they would come before doing any cosmetic procedures. We have to project in the future, how would you like to look like? And will the procedures now actually lead you to that situation or not? So I think this bentoism process is actually very useful even in the medical field. Next slide. So remember, when I started the lecture, it all starts with a question. Next. Do you still remember who was me before the COVID-19 pandemic? It seems like a distant past already. Next. Yes, and the next question is who is the future me? And in trying to answer this question, next slide, please. Next. We had gone through the process of discussing liminal change as an opportunity, liminal space as opportunity for change, and reassess who we are and who we will be. Moreover, Bentoism helps us in reassessing the values in shifting from me to us. Next slide. So the question now is, next slide. From the future me, we now revise our question, who is the future us? I think when we start of the future us, we actually realized that we had experienced this pandemic collectively, that we, in a sense, were traumatized collectively as well. So that is us. And therefore, for the future, we would also now plan to heal collectively as well. That I suspect, or that I would like to think, will be one of the directions the future us would be. Next slide. Next slide, please. Okay, so in this short lecture, we have talked about the global pandemic, we have talked about the liminal space, and Bentoism. Next. Next slide, please. So thank you very much for listening, and I'll be happy to answer any questions.
Okay, so thank you very much, Dr. Sison, for bringing up this topic on the liminal space and the concept of Bentoism. And I'm sure our audience now were able to understand these concepts as far as how they would apply this in their lives. These are two topics that are something new, even for me. I just understand what these concepts are. First question, Doctor, do these two concepts always go together? Meaning to say, if you practice Bentoism, there should first be a liminal space, or it can go independent. What do you think?
Okay, that's a very good question. Can you hear me?
Yes, yes, yes.
Okay,
yeah,
very good. Okay, thank you. That's a very good question. You have to understand that the book that Yancey Strickler wrote on Bentoism was actually published before the pandemic. The context of this was that he wanted a paradigm shift wherein he wanted not to be just guided by profit, but also how to not only deal with profit, but also put his values as well. So it's not all commerce. It's also how the values, and some of these values would be caring for yourself, caring also for your family as well. So you don't need to be in a liminal space. It just so happened that we all are in liminal space, and I'm suggesting that this mentoism will actually help us clarify how we can deal with the liminal space. But certainly we don't need to be in liminal space to be able to apply Bentoism. At least that's my
Okay.
opinion.
Okay, so while we're waiting for the questions from the audience, let me put in some additional questions. Now, putting into the concept of the current pandemic that we are going through right now, how do we practice these concepts of liminal space and Bentoism? Now, earlier I saw in your slides that you were able to, touch on some aspects of this, but just to give a clear picture as well to the audience now, how do we practice this?
Okay, as you know, liminal space is just the awareness of the uncertainty of the times. And I think once you accept that it's uncertain, your expectations are more appropriate. You will not have unrealistic expectations about, how to plan and everything when things will go back to normal. So in terms of liminal space, it is precisely the uncertainty that we really have to embrace. And in embracing it, it forces us to rethink about who we are. It forces us to think beyond our normal thinking process. And for me personally, I think I did also, because there was a lot of time, I also self-reflected on my own values as well. Now, with regards to Bentoism, I think Bentoism is something that we can apply even if you're not in liminal space. As I mentioned earlier, I think it would actually be a useful tool to use even in medical practice as well.
Okay, now there's a question from the audience, Doctor. When you talk about Bentoism, are you referring to compartmentalization of events? I suppose this is the question now. Does it make you feel easier to deal with things in general when you talk about Bentoism?
I'm not sure if I understood the question. Can you repeat the question, please?
Okay. Talking on the context of Bentoism, how does this, okay, are you referring to compartmentalization of events? Is this what we mean when we talk about Bentoism? You compartmentalize these events?
Events. Okay. No, that is not, well, perhaps, well, obviously, if you look, that's one way of looking at it, in the sense that there are 4 compartments. But the 4 compartments is just one way of identifying the area. Remember, we started with the initial graph of just me and just looking at profits. When you extend the bigger graph, you see the bigger picture, but the terrain there is just like a map. It's just telling you that this is something you have to factor for. And you also have to factor not just for you, but for us, and also for the future us. Does it compartmentalize? Well, that will be one aspect of it, because indeed there are 4 compartments. But I think it goes beyond that. It forces us to think beyond who we are now and what we want now into a much bigger space. I think that's the essence of what Bentoism is. And the 4 compartments just reminds us that we have to factor in. This is something that we have to factor in when we plan. So I'm not sure if I answered your question, but that's how I would explain it. Yes. Thank you. Thank you for that question.
Yeah, in addition to that, Doctor, the way I understand Bentoism, it's more like a lifestyle. It's a way of lifestyle, because here, for example, putting it in the context of the current pandemic that we're going through, for example, will I go out or will I stay at home? Now, if I stay at home, this is what will happen. I can't feed my family. I'll starve. But if I go out, I can feed my family, but I'll have a higher risk of getting the virus. So, kumbaga, it's a decision that I'm making. So I now compartmentalize it. No? If I say no to the current me, then ito yung magiging consequence. If I say yes to the current me, this is the consequence. But if I say no, you look at the context of the collective context in general. Ito naman yung magiging consequence niya. So is that right? Is that a right interpretation of Bentoism?
Okay, I think that's very interesting. Remember, if we all will be answering that question, we will all have different answers to that. Meaning to say, we all have different circumstances, and we are going to answer that Bentoism as an individual. Like for me, for example, I weighed one of the things that made me decide just to stay at home the lockdown was not just concern for my health, but also for the health. I live with my 94-year-old mother. And that was certainly a very big factor that I considered. So that was the now us. And certainly, if I'm going to project to the future, I certainly want my mother to still be with us. And also for the future me, I certainly want to still be alive. So for me, that was how I would have answered that Bentoism box. Of course, for another individual, under different circumstances, their answer would be different, and they would be deciding their behavior based on that.
Okay. Another question, Doctor, is you mentioned that liminal space is where the period of uncertainty happens, diba? And the way to deal with this is to be serene, diba? So how can people suffering from some anxieties use this liminal space to help them not to focus on the things that they could worry about, pero they would be, they would become something like that?
Right. Okay. That's a fairly actually a good question, but it may entail a more complicated answer. It will depend, of course, on the nature of. It will, of course, depend on the level of anxiety. If we're talking about clinical anxiety level, then certainly they would need to see a mental health professional. If you're just talking about an individual who is anxious about the future but not in a clinical range, then definitely one way of dealing with that is because the reason why you're anxious is because you don't know what's going to happen. But when you accept the fact that you really don't know what's going to happen, and you really cannot control that, then you realize that, okay, even if I'm anxious, it's not going to change what will happen. So why don't I accept the fact that I don't know what's going to happen, and let me focus on something else. Let me focus on something that I can do for myself now versus worrying in the future. I think if there's anything that I notice in myself is that I really did worry a lot and project a lot into the future. And during this lockdown, I got to appreciate what I was doing at the moment. I got to appreciate what it really felt like being present at the moment. So that for me was a change. Although I don't think I really was very anxious about the future, but I did notice there was a shift because, as I mentioned before, typically I would plan all my trips, I would plan all my activities at least 2 years in advance. And now I realize I cannot do anything about that. I cannot even plan any international trip. So having said that, instead of worrying about it, okay, so what can I do now? And in asking that question, I actually realized, okay, why don't I just be present now and just worry about that when things get better?
Okay, thank you for that clarification as well, Doctor. There's a question from Dr. Leo Caro. Dr. Caro, it's nice to have you with us. And he says, how do you deal with others who, unlike you, refuse to see the future us and insist on his future me?
That's a very interesting question. Well, let's put it this way. In the uncertainty, it is an invitation it's an invitation for change. And until you see it that way, if you still insist on behaving the way you did before, you are going to have problems because the world is not like before anymore. And therefore, since the world has changed, it certainly makes sense that even you should change as well. So, what do we do about this? Invite them to see that yes, that's one way, but is this way making you happy? Is this way making you feel calm? Because if it's not, then why don't this be an invitation for you to try another way?
Okay, thank you for that answer, Doctor. Here's another question. What about for
Thank you,
narcissists?
Dr. Caro.
What about for
I'm sorry.
narcissists? Yeah. What about for narcissists? Will there be no us?
I like that question. Okay, what about narcissists? That's actually a good question. Now, okay, they certainly will be insensitive to other people and are just so preoccupied with who they are at the moment. But even a narcissist would also recognize the importance of having people in their lives. And although that a narcissist, by definition, will not put too much value to them, but it is a process. I think because this is in that us, it is really an invitation to think beyond. A narcissist admittedly may have more difficulty in doing that, but certainly it's not possible. But if a narcissist in these uncertain times, I think and because of the instability of the situation, I think anyone would see the opportunity of rethinking or maybe looking at things in a different way. So yes, in spite of a person being narcissist, I still feel that there is that opportunity to look at things in a different way, more so because we are in liminal space. I would like to be optimistic about it. But thank you for that question. Very interesting question.
Yeah. Here's another comment, Doctor. Actually, it's not a question. Yeah, very interesting discussion. Supposing the person just concentrate in the now me and refuses or try to ignore the future me, especially in this time of pandemic where everyone, a health worker at that is very fearful. Also, another comment. We have to teach Bentoism in grade school and train kids to consider decisions in context of society and context of tomorrow. Thank you for this lecture. This is coming from Miss Liana Robodo. Very.
Oh, yeah. Wonderful question. Wonderful comment. Thank you, Liana. I know her. Yes. Hi. Yes, I agree fully. Beautifully said. Thank you, Liana.
Miss Merly de la Cruz, is it possible to apply the bento box with the present situation? We remain in the liminal space. We do not know what will happen next.
Yes, that is exactly. Okay. Yes, I see where that's coming from. In liminal space, you really don't know what's going to happen. So it's almost like a paradox. How can you plan the future me if we don't know what's going to happen? But that is exactly why it makes it exciting. Because you don't know what's going to happen, you now think of what exactly do I want? Did what I want to be 10 years ago the same future me that I want right now? Yes, it may seem like a paradox because yes, and I see where the question is coming from. It is uncertain, but in the uncertainty, you are allowed freedom to dream of what your future would be. So in that sense, it's also very liberating, because if it's still within a normal situation, you are constrained on, what your choices would be. But because of the uncertainty, you could decide, really, or you have the freedom to decide of what the future me would be. And I think that's very exciting. Yeah, thank you for that very good question.
Yeah. Thank you very much. Doctor, we still have a few more questions left before we end the session. And I like how this concept
Sure.
covers not only individual, but also, corporations, which you mentioned in your slide a while ago, that we can also use this concept of Bentoism even in corporations. So can you expound more or give some examples on how we can use this concept?
Okay. Thank you for that question. Actually, um, I ventured. My basis for this lecture was actually reading the from the website, as I had shown in my lecture. I think if you'd like, I think you should actually read the book of Yancey Strickler,
Yes.
where he'll be sharing his corporate experience on that. Remember, I'm not an entrepreneur, so I do not see from corporate. If you notice in the later part, I actually like this idea, and I think it even goes beyond the corporate world. I actually think it has potential to be applied even in the medical world, specifically with me interacting with patients. So I'm not the best person, perhaps, to discuss this when it comes to applying for the corporate world. I had actually just understood the concept, but like everything else, you could perhaps, if you're a business person, you could perhaps just try it first initially, and maybe try it in bigger groups and see how it would be working, so you can develop skills. So thank you for that question.
Okay, doctor, before we end, the audience might be interested. Where can they find you?
Oh, okay. Where can they find me? Yes, I my clinic is actually at St. Luke's, Quezon City. You could ask the trunk line. My secretary will be happy to reply to any queries you may have. Thank you for asking, Fortune.
Okay, so there you have it, guys. Thank you very much, Dr. Tofi Season, for bringing this very interesting and new concept of the liminal space and the concept of Bentoism. You know what? Whenever I go to any Japanese restaurant and eat something that is served in a bento box, I would look at it differently now. It's been a great time having with you on Health Talk, Dr. Tofi. Thank you very much. And guys,
Thank you.
every Saturday at 3 to 4 in the afternoon is our Health Talk brought to us by Zach at Cyrus. And this is our lay forum activity wherein we can reach out to the masses and to not only people in the Philippines, but also around the world who are interested to watch us. So my name is Fortune, saying goodbye and God bless you all, and see you next time on the next episode of Health.